Hey YouTube. Hi Spotify. It's been a little bit since I've been on. I think it's been a few days since I did my last recording, but I wanted to come on and do a podcast. And today we're going to start a video series, a massive one actually, on substance abuse, dependence, misuse, and recreational use, and just kind of covering all the gamut and the all of the information that I personally have learned as a substance abuse therapist. And I worked in the field, specifically, I worked in the field for 5 years, uniquely, tailoring to substance abuse and addiction treatment centers. And that also involved eating disorders, but that's going to be a whole different series. But also, substance use and addiction also has just kind of infiltrated all the other areas of my practice as well. It's, been involved in my private practice. It's been involved in my, when I had my earlier years in psychiatric hospital administration, and also when I worked with kids and their, at-risk youth. And so sometimes they would struggle with substance use even in their teen years. So just a forewarning, my cats may be joining us like they always do. When I start a podcast, they just like magically pop up. So forewarning on that. And also today is just going to be a basic intro, just some things that I've learned and kind of a preface to what is to come. But I thought I would just pop on and share what I personally have learned as a therapist. Again, I'm a licensed marriage and family therapist. I've been licensed since, gosh, it's probably been about 20 years or 15 years. I've been in the field for like 20 years, but licensed, I think, specifically for like at least, gosh, over 15. So maybe 20. Can't remember. So I basically, one of the things I really wanted to start with today is talking about substance use and abuse. There's so many different ways you can look at it. There's so much you can say about it. But I wanted to really talk about today, looking at it from a central nervous system perspective, which I know people are going to be like, what are you talking about? But they are categorically described, a lot of drugs, as stimulants or depressants. So you have classes of drugs. I'm going to list you the classes of drugs that you have. We have stimulants. We have depressants. We also have, and I have the list here, so I'm going to read off. We have the category of opioids, which fall under the category of sedatives. So when we're talking about central nervous system, what the effect that it has on your central nervous system, it would be a sedative. Yep, here comes one of my cats. And then we have, so that's opioids. And then we have hallucinogens, which we're not going to cover too much. And I'm just going to tell you why, because I didn't have too much, to be honest. I didn't have too much experience covering that in treatment centers. And then we're going to talk about cannabis also in this series. And then the last category is inhalants, which is a newer category. And we're not going to talk about that one too much either, because again, I didn't really have that much experience dealing with it. But one of the real big things I wanted to get across to you today in this session is very interesting, because most of the time in these treatment centers, when you work in substance abuse addiction treatment centers, what we also call them are called dual diagnosis treatment centers. Now, why do we call them dual diagnosis? Because typically you have what is called, the substance abuse or addiction as a primary diagnosis, which is kind of like the surface of what you see, in people. You'll see the alcohol addiction or the, opioid addiction or whatever. And then you also have typically simultaneously a underlying or secondary emotional disorder going on underneath, which is what I would look at as like kind of the root of the situation, and typically the emotional cause for which the client is typically trying to numb out or not address or not get into. And so they typically use, drugs as an escape. Now, I have had clients say that boredom is the reason why they're just, escaping because they're bored. That's a very small minority. What we'll get into today is a lot of times what is underneath and is the secondary diagnosis. So underneath the addiction is typically either some kind of depression, some kind of grief, some kind of anxiety, or some kind of trauma, complex trauma going on. And again, I am completely generalizing in these videos. I will just be generalizing. There's going to be exceptions to everything that I'm talking about. And, of course, I'm not saying in all or nothing concrete terms. I'm just speaking from my own personal experience and what I saw, throughout my 5 years or more addiction treatment center work and psychiatric hospital administration. I had a few years working doing that. So this is what I saw in that. And so typically one of the biggest things that I wanted to kind of get across to people, because I found it fascinating when I saw it firsthand. And I learned this from one of the 12-step experts, who was, she learned it in the rooms. They call it in the rooms, like, she was a recovering, she had had a lot of sober experience, and was one of, she was a case manager at the treatment center that I worked at. And she said, we can always tell what primary diagnosis a lot of people they're really struggling with by what their quote drug of choice is. Now, what is a drug of choice? I mean, it is what it sounds like it is. So basically, it's if people had their choice of what drug to use, what drug would they use, or what drug first got them addicted? Not necessarily even what drug first got them addicted, but really like what is a drug that they love to use the most. And you can tell a lot of times what their emotional quote disorder or underlying emotional issue is because of that. Now you're probably going, what are you talking about? I don't get it. So let me explain. Again, coming back and circling back to the central nervous system issue, what's typically very interesting is, now if you think of like central nervous system is kind of like, okay, here you are baseline, right? And you have like a spectrum of your central nervous system, and there's a baseline in the middle is like basically where you're centered and your, quote normal is on your baseline. If your nervous system is hyperstimulated, you go over here and you can be in the like hyperstimulated central nervous system. Your sympathetic nervous system can be an overload. And a lot of times what will result in is anxiety, and your heart's racing faster, you are overstimulated. Okay. And then you can have a spectrum of the nervous system disorders over here, where if you are under your baseline, you can sometimes fall into the depression camp and you feel understimulated, and you're lacking motivation, you're lacking energy, you're basically, you're tired all the time. So instead of being overstimulated and feeling like rushed and like, your heart's racing all the time, you're basically understimulated from a nervous system perspective. And that can lead to sometimes depression or deficient in like endorphins or, feel good neurochemicals in your brain. So now think about, what does that have to do with what your drug of choice is? Well, if you are understimulated as a baseline in your nervous system, say you border on, some kind of depression, then you may be drawn to, as a drug of choice, you may be drawn to a stimulant. So, and we're going to get into this in the future, but you may be drawn to something like a methamphetamine or, there's lots of different kinds of stimulants. We'll get into it, but in the addiction treatment center, it was like methamphetamine, cocaine use. I'm trying to think of the other ones offhand, but I'll get into them in the future. But things that quote bring you up. Okay, so what they're actually doing is upregulating your nervous system to what you feel is like a more normal, so that you feel more alert, you feel more on top of it. Like sometimes ADHD meds can do this for people. They're stimulants, but that's a whole different thing. But so stimulant medications upregulate your nervous system to make you feel to where you're back into your baseline, right? So now again, that we're talking about methamphetamine is typically, the biggest one, in cocaine. Those are your biggest typical stimulants. Now, coffee or, energy drinks or something, that's like on a very small level, but that would be qualifying as a stimulant. So if you were feeling tired, you're obviously going to be drawn to some kind of like small level stimulant like that. On the other hand, if you have a quote, a hyper regulated nervous system, or like if your nervous system feels like it's in overdrive on it as a baseline level, then you may be drawn to what are called depressants or sedatives. So why? Because it's going to slow down your nervous system and make you feel quote normal on the slower way. So you might not feel, you might not like feeling like hyped up. You might to like feeling more chill and relaxed, and so, like we said, opioids can be that. Can certain strains of cannabis can do that. There's a lot of other, different medications we'll get into in the future again when we talk about sedatives specifically, because I'll do videos on all of these. But basically, the point is that one interesting way to look at what emotional issue you may be struggling with underneath substance use could be which quote drug of choice are you inclined to use and at which time. Now, I'm going to give you a personal example. I don't struggle with addiction, but I kind of like in the morning, if I'm extra tired, I will go for coffee. That's a stimulant, so, and that's like if I'm feeling like understimulated in my nervous system, I go for, a cup of coffee or two. Then in the evening, like, sometimes if I feel like I've had an extra stressful day and I got stressed out during the day, and again, I don't drink alcohol to, take the edge off. I do know other coping skills also, but I do sometimes like to have a glass of wine just to, like, quote, "unwind" a little bit, and that is going to, that's if I'm feeling hyper hyped up in my nervous system, it's going to, quote, "take the edge off," or, like, down regulate my nervous system, okay? So, and I'm not recommending that. Of course, the best thing to do is to regulate your nervous system without substances, right? But I'm just sharing from my perspective that I know exactly like where I am in my nervous system and why I'm taking certain things just because it has a little bit of an effect on my nervous system, right? So, now you can see this a lot like with, well, certain professions we'll get into in the future. Sometimes if they've had a lot of trauma in certain professions, like firefighters or police officers, sometimes if they have a lot of trauma over time, it can actually lead to a chronically hyper regulated nervous system to where they're like hyper anxious all the time from the trauma. And so then they can end up having things like alcohol issues. This is the same with PTSD. Again, we'll get into this in the future, but same with PTSD because it's a hyper anxious nervous system. So they are more inclined towards certain sedatives or depressants that will bring that anxiety level down if you've suffered a certain amount of trauma. So it's very interesting. I just want to start this, I'm not, a lot of times we've all had the health classes that explain what the categories of drugs are, and I will get into those in the future just to kind of clarify for everybody. But I did think it was very interesting because I'd never, even in all of my years of school and everything, I had never heard like this one woman who said, you can tell what someone is struggling with deep down by what their drug of choice is. And I was like, oh my gosh, that's so genius. And from a nervous system perspective, it makes so much sense. So I just want to start out our talk based on that. So when you see someone who is always wanting a sedative or always wanting a stimulant, you can know, oh, they're probably dealing with their primary probably issue underneath that is either anxiety or depression. And why is that important? Because then you can deal with those root issues in other ways, right? Like if someone wants an antidepressant or they need to just work out more and get more like natural endorphins for the depression, or there's other certain like diet changes you can make to, get more um feel good chemicals in your brain. So it's like, but or like the anxiety, there's definitely certain other ways to manage it. But it's important to know like what is the root cause, what you're dealing with, what are you trying to self-medicate when you're using whatever substance, right? Typically what I have seen most in my life, in my practice, in my experience is that when people use and or overuse, especially overuse or have any kind of problem with substances, they are self-medicating, whether they know it or not. They're self-medicating some kind of emotional issue. They're numbing out some kind of pain, some kind of emotional hurt, betrayal, trust issue, depression, again, depression, anxiety, whatever it is. And they're doing it through substances to regulate their nervous system and kind of avoid it for the time being and hope it goes away. It's really like, so this is obviously a very sensitive subject. I'm not going to be able to do it justice at all in the series that I do. I'm only attempting to just do basically a few videos of like interesting things that I have seen and learned throughout my experience. But I do feel like it's important to talk about, just like, I did a video a while ago, and I'm going to keep saying this throughout every video probably, but just like, for instance, how important it is for family members to have boundaries with those who have any kind of substance abuse issues, because that really does end up having an important piece of the puzzle for someone wanting to go to treatment if they really do suffer from substance addiction. So, anyways, this was all over the place a little bit, but looking at substance use and abuse and addiction from a nervous system perspective is, I do believe, probably going to be the future way to look at how how people suffer from um substance use and abuse, and what it is they're trying to, what nervous system dysregulation they're trying to self-medicate. So I hope that this was helpful. Again, they're obviously avoiding like emotional pain really at the core of it too. And one thing I'm going to say, and I'm probably going to shout it out in every video, is that AA, as much as some people have given it like a bad name because there's a higher power element to it, hands down, even I would say even above therapy, but definitely hand in hand with therapy, hands down, AA is crucial, or whatever kind of Narcotics Anonymous, or whatever kind of drug anonymous you is relevant for the drug. It is so crucial for healing and crucial for recovery, crucial for sobriety, the accountability, the community that you build, the what you learn in terms of how to process your feelings, in terms of vulnerability and communication, and um, you know, being able to get a sponsor and watching people who have done it. I mean, it's just there's so many different facets to the way that AA can heal you, and the 12 steps. I mean, it's just phenomenal. So, and it's free. So I highly, highly, highly recommend you can go online. Your first ones, if you're just curious about it, they have free online meetings that are anonymous, and so you can try that if you struggle at all. But I also totally recommend you going in person. Most meetings are not judgmental in the slightest. They are the most welcoming, incredible places with the most beautiful, human beings who are very smart, very savvy, very funny, very incredible human beings who just happen to struggle with addiction. And so I hope that this video helps you, and I hope that you found it well, and I hope that you're doing well wherever you are, and I will see you guys next time.